session. Joining us today are the Honourable John Haggie, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon, everyone, and thanks for joining us today for our COVID briefing. As usual, I'll pass the floor over to Dr. Fitzgerald for her update.
Thank you, Minister. Thanks, everyone, for joining us. Since the last media advisory, we have 6 new confirmed cases of COVID-19 in our province, all in the Eastern Health region. 4 cases are related to travel. 1 individual is under the age of 20, 2 are between 20 and 39, and 1 is between 50 and 54. There are 2 cases in individuals under the age of 20 who are contacts of a known case. The total number of cases in our province is now 1,456. There have been 3 recoveries in Eastern Health, leaving 12 active cases in the province. No one is in hospital as a result of COVID-19. And a total of 266,406 tests have been completed to date. After going quite a long stretch with very few cases, we are starting to see an increase in cases due to travel, and we do have a small cluster emerging in St. John's. The identified cases are isolating, and Eastern Health is conducting contact tracing. Unlike our outbreak in February, we now have a good proportion of our population vaccinated, and this changes how we manage contacts of cases. Testing and isolation now takes the vaccination status of the contact into consideration, and anyone who is identified as a close contact of a case will be contacted by public health and given instructions specific to their vaccination status. If you are 14 days past your 2nd dose, you are considered fully vaccinated, but not before then. You may not be required to isolate if you are fully vaccinated. However, there are some situations where fully vaccinated individuals will be required to isolate. You are required to follow public health instructions. If you are unvaccinated, or if you are not 14 days past your 2nd dose, you will be required to isolate. Public health officials are working very hard to ensure that our communities are safe as we try to reopen while living with COVID. They have been working tirelessly throughout this pandemic and continue to do so. I know that there is COVID fatigue, but I ask that you be kind to public health officials and cooperate with these people who are working so hard to protect us. As part of the ongoing investigation, we are asking anyone who visited the Tim Hortons at 283 Portugal Cove Road in St. John's on Thursday, August 12th, between 8 p.m. and 9:30 p.m. to arrange testing. This does not apply to patrons who only use the drive-thru. People can arrange testing by completing the online self-assessment and referral tool or by calling 811. People who visited this location and currently have symptoms of COVID-19 are required to isolate until 24 hours after their symptoms resolve and they receive a negative test. People who visited the restaurant during this time and do not currently have symptoms of COVID-19 are not required to isolate until they receive a negative test result. While awaiting their test result, they should monitor for symptoms and isolate should any symptoms develop. For the last 17 months, new cases, clusters, and outbreaks have undoubtedly created a sense of anxiety for most people, and it's going to be an adjustment for all of us to learn to live with COVID. But live with it we must, and we cannot keep society closed forever. It's important to remember that the goal is not to stop any cases from coming into the province at all. Cases will be imported here through travel, and we need to accept that reality. Our goal is to prevent deaths and preserve our acute care hospital capacity. We do this in 2 ways. First, by increasing our vaccination rate, and second, by practicing our tried and true public health measures. Every percentage increase in vaccine administered significantly reduces our risk of a fall surge. 85% of the eligible population has had a first dose, and about 70% has had a second dose, which is wonderful. We are working diligently to get that fully vaccinated number higher and ensure our population is better protected. Data from the Public Health Agency of Canada shows that 90% of COVID-19 cases are in unvaccinated individuals, and less than 1% of cases and hospitalizations are in fully vaccinated individuals. These numbers paint an incredible picture of how effective our vaccines are, and high vaccination rates across the country is key in protecting people from severe illness, ending the crisis phase of the pandemic in Canada, and helping everyone return to normal activities. At the very top of the list of normal activities is ensuring students can return to school in September in a low-risk environment. So those of us that can be immunized need to build that barrier to protect those who cannot be immunized, particularly those under age 12. It is possible we will be into late 2021 or even 2022 before a vaccine is available for children. That's why it's so important for parents, guardians, and eligible siblings of those under 12 to get their vaccinations, as well as students 12 and older in the K-12 and post-secondary institutions. We need to have as many students as we can fully protected for the start of the school year. And the U.S. is currently seeing a robust fourth wave, which is impacting children more so than the last 3 waves. And we are following what is happening with respect to children and COVID-19 very closely. If the epidemiology and evidence warrants a change in guidance for schools, we will not hesitate to pivot with our advice. If you are an eligible student or a parent of a student that has not yet been vaccinated, please do not delay that first dose. If you have questions or concerns about the vaccine, please turn to the right sources for answers. You can also speak with a healthcare provider, such as your family doctor, a pharmacist, or a public health nurse. Misinformation is among the top reasons for vaccine hesitancy, and in the age of social media, misinformation is abundant, highly accessible, and even convincing. Children and youth may come across false information online related to COVID-19 that can be harmful. Please talk with your children about what they are reading or watching and help them to understand what information sources are credible. If you had a first dose of Pfizer, please do not delay your second dose just to receive the same product. Interchanging mRNA vaccines is safe and effective. We have enough Moderna on hand to give second doses to everyone who is eligible, and we have enough supply of Pfizer to give 2 doses to all those between 12 and 17 years of age, as that's the only vaccine currently approved for that age group. At this time, we will not have enough supply of Pfizer to give second dose to all those 18 and over that receive Pfizer as a first dose. So waiting it out is a personal decision, but please know that it comes with risk. Please remember that our focus is still on saving lives and preventing illness, not international leisure travel. It is still early days, and we need to give countries time to review the evidence and for international travel to be considered safe. We should also keep in mind how fortunate we are to have the vaccine available in Canada that we do, while some countries have little to none. This is a global pandemic, and we all need to consider the global picture and our ethical responsibilities in that. I've asked you many times to be kind, and right now, making the choice to receive 2 doses of COVID vaccine, regardless of the brand, is one of the kindest things that you can do to protect your loved ones and your community. From the beginning, this has been about working together and looking out for each other, and as a province, we have risen to that challenge. That same kindness and caring needs to guide us through our vaccination program as well. Life in our province is starting to look very much as it did before COVID-19. That is thanks to the more than 400,000 Newfoundlanders and Labradorians that have stepped up and made the choice to be vaccinated. Together, you lowered our risk and made it possible to significantly ease restrictions in the province. But we still need to be careful. It will be so unfortunate for us to collapse just before reaching the end of the marathon. I assure you the end is in sight, and we will get there if we practice our tried and true public health measures. So please continue to wear your mask in indoor public spaces, especially if you can't physically distance or you don't know everyone's vaccination status. Wash your hands well and wash them often. Physically distance and avoid hugging or shaking hands with those who are not your close contacts. Most importantly, stay home if you have even one symptom and get tested. If your child has symptoms, keep them home. Even just a runny nose or sore throat is enough to warrant a COVID-19 test. We need to assume any symptom could be COVID, and even if it is not COVID in the end, it is most likely a respiratory virus that can be passed on to others, who in turn will need to stay home and get tested. As a recap, for those who may have just joined, we have 6 new confirmed cases since last media advisory, and the total number of cases in the province is now 1,456. In the last 17 months, we have given you all the guidance you need to protect yourself, your family, and your communities. As restrictions continue to ease, individuals, families, organizations, and businesses need to carry the torch onward. You have the tools and the know-how to prevent the spread of COVID, and I know that you have the determination to see us through to the end. So hold fast, Newfoundland and Labrador. Thank you.
Thank you very much, Dr. Fitzgerald. Before I begin my COVID remarks, I'd like to pass on my personal condolences and those of the healthcare system to the family of Dr. Bautista, who passed away recently. He gave a lifetime of service to the people of this province and made a name for himself originally with the sanatorium and tuberculosis. Our thoughts go out to you all at this difficult time. We are seeing cases again of COVID-19, and we kind of expected it. We also have a very robust contact tracing system, which I think could be regarded as the envy of other jurisdictions in Canada and certainly jurisdictions around the world. They're doing what they do best, and we will find and track down the contacts of these cases. Again, vaccination has become the key and is a game changer. I'd like to give a shout out to the regional health authorities. They've pivoted yet again, and we had pop-up clinics here at Eastern Health at the weekend. And low barrier. You can just walk along and get your COVID shot while you do your shopping. In Deer Lake today at their famous Hump Day Market, there is a pop-in clinic today. No appointments are needed. The RHAs, of course, still have listed on their website a whole variety of walk-in and pop-up clinics to come. So keep your eye out for that if you need your second or indeed first shot. Our vaccine numbers are excellent. Dose 1, 85%, and dose 2 creeping to 70%. We do have some patchy distribution, though, across the province. I was out in Central over the weekend, and I noticed the northern areas of that region are lagging behind, particularly in first doses. And I would encourage them to go out and get the shot. There are clinics that are handy and more to come. Dr. Fitzgerald referenced trusted sources of information, which have become crucial during this pandemic for a whole variety of predictable and unpredictable reasons. 811 has been a mainstay of healthcare in this province for some time. Snowmageddon kind of gave it a stress test, and then shortly on the heels of that, we had COVID-19. It has become a trusted source of information. Now, we would like, however, to focus a little more on its original purpose, which was to provide health advice, poison advice, virtual care, and nurse practitioner access on a real-time or an appointment basis. And I emphasize this because there are other inquiries that are putting a strain currently on 811, and this is information that can be gleaned elsewhere. So this is around COVID and isolation and these kind of things. This information is readily available in a pretty accessible format on both the federal and provincial government websites, as well as the regional health authority websites too. So I would encourage people to use those sources for that kind of information so that we can devote the resources of 811 to the purposes for which it was originally intended. So once again, I would echo what Dr. Fitzgerald has said. We're doing well with the vaccine. There's still a ways to go yet. So if you haven't had your second shot yet, go and get the shot. So thank you very much, and I'll turn it over to Leslie for the media.
Thank you, Minister. For the benefit of our speakers, we have 2 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead and make your way to the mic.
Right. Thank you. Dr. Fitzgerald or Minister Haggie, for children 12 or turning 12 in this calendar year, are they able to go and be vaccinated, or do you have to be 12?
So right now, and this is true for any of our vaccines, we have age limits on some of them, and so you have to be 12 when you get your vaccine. So if you're going to be turning 12 later in the year, then you wait until you actually hit the 12 mark, and then you can get the vaccine.
Thank you. And in Ontario, we've noticed that they're beginning to do booster shots for those who are higher risk or more likely for severe illness, vulnerable. Is the province looking to begin to introduce this as well, especially with the demographic we have?
Yeah, so certainly those conversations are happening, and we're waiting, or we'll be following the advice of the National Advisory Committee on Immunization in that regard. I think what we had to remember with this group is that it's not so much a booster as much as it is that some people might need 3 doses of the vaccine to get that primary immune response because of whatever the condition may be. So it's not so much a booster dose as it is trying to ensure that people are getting the maximum response that they can from the vaccine to start with. And that happens with other vaccines. We do have some vaccines where we have to, depending on the medical conditions of the person receiving it, may need to get a higher dosage of the vaccine or may need to get more doses of the vaccine to get the same response.
Our next questions are from Meg Roberts with CBC. Please go ahead and make your way to the mic.
Hello. Ontario is mandating vaccines in some sectors, or they're requiring regular testing. What is the plan here?
Certainly, we're following what's happening in other jurisdictions with regards to mandatory vaccination. Our view here is that we need to find out what Justice and Public Safety view this as. From our point of view, it's more a legal and charter issue at this stage. Our vaccination figures are actually extremely good. Our first dose is probably better than any other jurisdiction in Canada. So we've got Justice, we've got Human Resource Secretariat and input from Health working on that, and we'll see what they come up with.
I guess, how concerned are you about this small cluster? And I guess, how is this happening, or who are you seeing these COVID cases in?
So right now it's certainly just a small cluster, and it's originally from a traveler, but or not originally, but we see the transmission that way. But so not unexpected as we have as we see more travelers coming into the province. Right now we have 4 cases in that cluster. There are, a fair number of contacts, so we expect to see more cases in those contacts. So I think it is really important for people to remember that we have to try to keep our contacts still low for the time being until we get, a higher proportion of our population more vaccinated. We are seeing, most of what we're seeing coming in right now is Delta, the Delta variant. So we know that is more contagious. And we know that the vaccine, while it is still quite good at preventing the transmission of Delta, Delta is just that little bit better at transmitting. So we're still seeing great figures with regard to preventing severe disease and hospitalization and death, but certainly transmission can still occur. So it's really on all of us to make sure we're still following those public health measures that we've been following right through the whole pandemic.
Thank you.
We will now go to the phone. Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Good afternoon. I'm wondering whether public health is on track as I was told last week, to offer new guidance on choral and wind instrument playing, choral singing.
Yes, so we have looked at that, and I believe some guidance is moving up through the approval process right now. It's already passed by my desk, so it should be coming out very shortly.
Okay. And the other question I have is, will there be some, given the nuances of singing, etc., will there be any revisiting of the physical distancing requirements?
So at the moment, physical distancing is still recommended, and as much as is possible. And we do know that, if there is a case of COVID in a situation, in a choir practice or something like that, it can still spread. So that, reducing the physical distancing, if it's going to spread, it can still do it even if someone is vaccinated, I guess is the point. So, we would still recommend trying to physically distance as much as possible. And if that was not possible, for people to consider obviously wearing masks to prevent, to reduce that risk.
Okay, thank you.
Our next questions are from Richard Duggan with VOCN. Please go ahead.
Good afternoon. Last week, the province released its back-to-school plan, and they say that it will be public health that will be determining if a situation is low risk versus high risk. So, Dr. Fitzgerald, what criteria will you be looking at in making that determination?
So we've outlined that in the plan, actually. If you look in the appendix of the back-to-school plan, the public health guidance is there, and it does explain what high risk and low risk would be. And so basically, low risk is low epidemiology, no spread of virus, or very, small amount of spread of virus, and good vaccination rates. But if we had to see a situation where we had a rapidly increasing spread or transmission of COVID-19, or if we were to have a situation where there were low vaccination rates in that context of increasing spread, if we were to suddenly see a variant that had vaccine escape, so was not showing susceptibility to the vaccine, or if we had an outbreak in a situation where we might have low vaccination rates or concern about a vulnerable population who may not form a great immune response, thinking like, long-term care facilities where you may have some people who are frail and elderly. So those are situations that would make it high risk. So there's no, we don't want to sort of set down, in exactly this situation it's going to be considered high risk, because this will be a very fluid thing, and what the number of cases in one situation may not actually be high risk, but in another situation, depending on vaccine rates, depending on what the population is that's infected or where we're seeing the transmission, it might be considered a high-risk situation. So it's certainly something that will be fluid and we'll be looking at. Public health certainly will be making those assessments as time goes on. But those are the things that we'll be taking into consideration when we're making those assessments.
And public health has been making the push for those in the 12 to, 18 year-old category to get vaccinated ahead of the beginning of school in a couple of weeks' time. Wondering if there are any numbers related to how many people in that age group have been vaccinated to date. And now that we are 3 weeks away from school starting, are there any concerns with the vaccine uptake for that age group so far?
So right now, in that age group, just give me 1 second, we have over 80% of that population has received at least one dose, and just over 55% have received 2 doses. So certainly we would like to see that that number for second doses up a little bit. I think a lot of people were trying to wait as long as they could between doses before the start of school to try to ensure that the immune protection was was the best that it could be to give the best immune response. And so they were probably waiting until the middle of August to be able to have that 2 weeks leeway. So I expect over the next couple of weeks we'll start to see that number increase a fair bit. But we're very pleased with seeing that over 80% of the population right now has gotten one dose, and that's a good marker, I think, for people wanting to get the second.
Thank you.
I'll now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV. Do you have a final question?
Yes, thanks, Leslie. Dr. Fitzgerald, I know I've asked in the past a lot of travelers wanting to know if there's an opportunity for them to get a third shot that will match. I know the push right now is to get as many people with the second dose, but people who had AstraZeneca for the first is where primarily the questions are coming from. If those opportunities will be there, and if we have to meet a certain threshold for second doses for that to open up for them.
So I think at this point, our goal, as I've said before, the goal of our immunization program is really to get as many people protected in our province as we can. And we know that 2 doses are what we need to do to make sure that happens. So we're really focused on second doses right now. We don't have any plans to offer third doses at the moment with regard to people who've had the first dose of AstraZeneca. I think as time goes on, what we have to remember, number one, if you're traveling within Canada, it's not going to be an issue. And there are more and more countries who are actually looking at the mixing of doses right now and are considering things. So I think as time goes on over the next several months, we will, and by the time most people will be thinking about traveling, because we have to remember there is still, Health Canada, Public Health Agency of Canada are still not recommending travel internationally. By the time we get to a point where most people will be wanting to travel, I think we will have the answers to those questions. So as I said in my speaking notes earlier, the most important thing right now is just to get vaccinated with 2 doses. And if you're deciding to wait, you are taking a risk.
Meg Roberts with CBC. Do you have a final question?
Yes, I do. I was just wondering, with the mask mandate being dropped, how do you think that's going, and do you foresee any changes?
So, I mean, I will admit I don't get a lot of time to go out, but when I have gone out and been out around, certainly I see most people still wearing their mask, which I think is really good. We still recommend that people wear their masks when they're in public places, and especially if you're in a situation where you can't physically distance, or you're not really sure if you're going to be able to physically distance, or that's going to be variable while you're there, and especially if you don't know people's vaccination status. So we're still recommending it. At the moment, we're continuing on as is. As we've always said, if anything changes, if our epi changes, if the evidence changes, then we'll certainly pivot to respond to those changes. And if we start to see an increase in cases in a certain area, it may very well be that we recommend masks, or that we mandate masks in that situation. But at the moment, of course, we're staying where we are.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
Yes, sorry. Just one quick one. Can you clarify again under what circumstances a fully vaccinated person would still have to isolate with respect to this contact tracing that's going on?
Yes, so certainly there are some people who may work in higher risk areas where we would still ask them to self-isolate. And that's really more to prevent spread into those higher risk areas if they're a contact. And then there may be situations where somebody is has 2 doses and we would consider fully vaccinated, but if they're in a situation, if they have medical conditions where perhaps they're immune compromised and may not be able to form a great immune response, then we would ask that they would isolate just because they're at higher risk of contracting disease. If there was a situation where we had someone with an active symptomatic COVID case in a household and you weren't able to isolate away from that person, so you're having continued exposure to active COVID disease, even if you're fully vaccinated, in that situation, you will likely be asked to self-isolate.
Thank you.
Richard Duggan with VOCM. Do you have a final question?
Yes, Minister Haggie, in your opening remarks, you said that you've noticed vaccine distribution has been patchy in some areas of the province. Why do you think this is? Is it an issue of access to clinics, for example, or is it people making the choice not to get the shot?
That's an excellent question, and really the answer is pure speculation. So I don't have a hard and fast answer. I do, however, believe very clearly that in the case, the areas I mentioned, that the health authority there has been extremely diligent in making access to vaccination both on a walk-in basis and on an appointment basis a priority. So I would be very reluctant to suggest that was the cause. I honestly can't give you an answer because I don't have one.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, just one really. If you haven't had your first or you need your second shot, go get the shot. Having you protected keeps us all protected. Take care.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.